Me encuentro con Christoph Glaetzer, director global de valor y acceso de Johnson & Johnson. Hoy vamos a hablar sobre el valor de la inversión en salud y en farmacéutica y el acceso a la misma en Latinoamérica con todos los desafíos que eso representa. Welcome, Christoph, and
Thank you.
Really nice to have you here.
Thanks for the opportunity.
How does Johnson & Johnson define innovation in healthcare?
Innovation is basically everything we do. We are dedicated to innovation since the establishment of J&J, and for us innovation is delivering the next level of breakthrough medication in the areas where we are very active in, and we covered specific disease areas where we try to lead where science is going by constantly look for the unmet need that exists in the disease areas, what is the next breakthrough medical pathway that we can explore, and then invest together with multiple stakeholders to deliver on this innovation as well. And from there, go to the next area that needs to be addressed and never stop exploring where is the area of unmet need, where is science is going, and where can we contribute as J&J overall.
Can you provide examples of how these innovations improved patients' results worldwide?
Yes, how many hours do we have? I have the pleasure to work for J&J already a couple of years, more than 30 by now, and by then have seen so many improvements in so many different disease areas, reaching from oncology to immunology, neuroscience, and within these broader therapeutic areas in specific sub-diseases like psoriasis, Crohn's disease in the immunology space, where we brought the first biologics to the market. From there, the next new mechanism of actions, always looking for further improvements, and have basically changed the life of patients. In my previous life, before I joined the industry, I was actually working as a nurse. I'm a certified nurse myself, and I have seen patients that were suffering from diseases like rheumatoid arthritis before biologics were available. And it was painful to see these patients trying to get out of the bed in the morning, and we as nurses could do nothing because we had no medications. 30 years later, the same patient would run a marathon or play badminton or tennis, right? It's because we have now these new technologies that transform the life of patients. The same is true in other areas. If you look at cancer, we are working in various areas, for example, multiple myeloma, where we have developed a couple of innovations over the years and now have also changed that trajectory of the disease and improved outcome for patients significantly. So there are many, many areas. I'm proud to be part of that story. And as I said, we will never settle because there's still a lot to do, right? There are still many disease areas where we have insufficient treatment options for patients, and we need to continue to invest and find solutions for these patients as well.
How is the pharmaceutical industry working on that changes?
The pharmaceutical industry is an industry that never stops. We always look for the next solution. It's a long-term play. When we invest in solutions right now, we know that it will take 5, 10, 15 years to actually then be able to deliver a concept that will help patients. We do this in close partnership. We have our own in-house development. We work with research partners across the globe and then hopefully deliver that next solution. Sometimes it doesn't play out as we wanted, as we had intended. No problem. We know that. This is how science works. We continue to look for the next solution, again, in partnership with stakeholders across the globe. And at the end, we'll be able to deliver the next solution. We have done this very successfully as an industry overall, but also as J&J leading in the areas where we're very active in.
What challenges does Latin America face in order to access to innovative medicines?
I think all healthcare systems in all countries across the globe, independent where they are right now in a situation where on one hand we see an increasing demand for healthcare from an aging population perspective, and we see fast-moving science, which is absolutely great. When I talked about these treatment options that were never available before. So with a combination of science moving and an aging population, the art will be to balance the two and utilize the benefits as well, and then drive the economies and the societies forward. And again, by not looking at it from a cost point of view, I think economies will be able to manage the best balance between these and improve the health outcome for the society overall while maintaining financial stability as well.
Different countries across the world, including Argentina, are evaluating the creation of HTA agencies. How do these agencies work and how do they improve the healthcare system?
Good question. HTA systems are out there in many countries in the world, and they work differently depending on what the specific ask is that they have in that country, which question they are supposed to answer. HTA systems can improve health outcome, but there's also the risk that they negatively impact health outcome by delaying decision making and by delaying or denying access to innovations for patients depending on what kind of HTA is used. So we see huge variation between the impact of HTA systems in the countries across the globe from an outcome point of view. Conceptually, they are there to improve outcome, and if they are set up in the right way, with the right engagement of the different stakeholders, if they ensure that there's a process in decision-making which is transparent, which includes all dimensions of value, and which is most important, patient focus, then yes, they can improve health outcome, but it depends on the question they are supposed to answer, the methodology they use, and how the decisions and the recommendations of an HTA system fit into the broader healthcare decision framework.
What is Johnson & Johnson's approach to promote sustainable health systems?
I think the biggest contribution that we have from a sustainability of healthcare system is delivering the solution. What we promote is a broad stakeholder engagement early on to identify which are the disease areas that are, or the healthcare challenges that are relevant in a specific country. How can we work together by delivering that specific treatment? How does that specific treatment fit into the healthcare pathways and as well in the country? And do this in a partnership with the different stakeholders, where healthcare professionals come in, patients come in, the government comes in, the healthcare system overall is relevant, that all needs to fit together. The advantage that we have as an organization is that we are working globally, basically, in every healthcare system that is out there, so we can also contribute by delivering and sharing information of processes that work optimal in one country that could potentially leverage in the others, always understanding that there's no one-size-fits-all, but there's a leverage very often between the different healthcare systems.
Thank you, Christoph, for all the answers, and it's a very interesting information for us.
Thank you for the opportunity. I enjoyed it, and I hope that we can work together in Argentina and across the Latin America region to improve health outcomes for patients.